Chemotherapy began in 1946 when the Department of Defense funded Dr. Goodman and Gilman at Yale University, very eminent pharmacologists who wrote the classic textbook on pharmacology, to find a medical use for mustard gas. So they did some laboratory experiments, and they just found, I mean, they were told to do it, they did it, they were funded, and in rats they could reverse tumors using mustard gas, which is, of course, used in war as a poison. And then they tried it on a single lymphoma patient who had advanced disease, and all those tumors regressed. And he did die within a couple months, but no one had ever seen tumors in a cancer patient regress with a drug, and that started the whole chemo regimen. But because of that extraordinary response in a single patient that lasted a few weeks, the entire chemo industry came into fruition. Drug companies loved it because you could patent these things. In a natural treatment, you can't patent. So cancer just there was a fork in the road. It could have gone toward natural treatments. It could have gone toward synthetic, and they chose to go with the synthetic drugs based on one patient. Now, interestingly enough, right about that time, around 1946, Dr. Gerson, who had his own nutritional protocol long before Kelly, had presented cases to Congress of cured cancer patients with a nutritional therapy. And there are actually hearings on Gerson's work, and I have the reports from those. But when the single patient responded, they forgot about Gerson and the nutritional and alternative. It all went toward chemotherapy. And for 90% of cancers, chemotherapy is not effective.
So for 90% of those cancers where it's not effective, why is it still used as much as it is?
That's a good question. One of the reasons I really like the Mayo Clinic is the oncology team there are extraordinarily honest. Not only are they extraordinarily competent physicians, the best in the country, but they're very honest. And I have patient after patient who's been to the Mayo Clinic with some kind of advanced cancer where the Mayo Clinic oncologist says, I'm not going to treat you because what we have to offer will not help you. A place like Sloan Kettering, I have patients who've been there with the same kind of cancers and they treat them with chemotherapy. Why the difference? I really respect the Mayo Clinic because they are famously honest with patients to the point where it's just amazing to see. And they've saved patients' lives because some of the patients I presented today in my lecture were diagnosed with advanced cancer like pancreatic, and the Mayo Clinic didn't want to treat them. Because of that, then they started looking into alternative therapies, and that saved their lives. But most oncologists don't follow the Mayo tradition, being that honest with patients. They will treat patients even though the literature shows that the chemotherapy doesn't work. Some of it's economic. It's hard to, it's hard to say that because you're accusing oncologists of doing things for money, but some of it's economic.
There was a study that was published, I believe it was in 1994. It was a 12-year program, 12-year study. They looked at adults who had developed cancer as an adult, not childhood cancer, but adult cancer, right? And this is the main types of cancer that we get here in the United States. They did a meta-analysis of these people all around the world who developed cancer as adults for 12 years and were treated with chemo. And they looked at the results. And they published the results in the Journal of Clinical Oncology. And the results? 97% of the time, chemotherapy does not work. 97% of the time, it doesn't work. So why is it still used? It's one reason and one reason only: money. The only reason chemotherapy is used is because doctors make money from it. Period. It doesn't work 97% of the time. If Ford Motor Company made an automobile that exploded 97% of the time, would they still be in business? No. This is the tip of the iceberg of the control that the pharmaceutical industry has on us.
Dr. Tutu Simoncini, oncologist himself in Rome, Italy, stated that the medical profession has a cancer cure rate of 2%. In my experience and a lot of colleagues, 27% of all people that have cancer and do nothing get cured. And you look at the background of the medical profession. John D. Rockefeller, the one that made the big money originally, he created the curriculum for the entire medical education in the world. And he made sure that only the chemicals he produced are used for the treatment of illness, no matter what it is. We are still working under the same premise today. That's why no medical doctor ever learns about curing anything. They learn about chemical intervention or surgery to suppress symptoms. They don't go for the root cause. They don't look for the root cause. They have never learned about curing anything. And they are a pseudoscience. Basically, the medical profession is a religion. That's why we have the problems with burn victims, of course. That's how they look in the inside, like a burn victim. Look at somebody that gets their face burned. How they look on the outside. That's how you look in the inside after radiation therapy. It's an assault with a deadly weapon. Chemotherapy, we talked about it, is based on mustard gas. Mustard gas is like the Agent Orange of the medical profession. And it goes, their premise is, the idea behind all of this is, if you have a garden with flowers and bushes and trees and grass and some weeds, you come with Agent Orange and you kill it all off. And now it's all dead. And now you hope only the good stuff comes back. The flowers and the trees and the bushes. And the weeds will not. What's usually coming back, and it's only the only thing that's coming back are the weeds. And the same is with cancer.
When you are exposed to radiation that's based on gamma radiation, it's basically ionizing. It will cause damage to whatever basic tissue it's being exposed to. So in the same way, chemotherapy is also designed to be genotoxic. So you're trying to target fast replicating cells. And so by doing so, it is by definition also carcinogenic. And so really, when we talk about resistance to chemo and radiation, it's really just a way of blaming the victim, because we're all, when exposed to conventional chemo and radiation, going to be harmed, and it is actually going to have a carcinogenic effect, and it will often cause secondary cancers. So technically, I think people need to be aware that this isn't truly a cancer therapy. At best, it's palliative in the sense that it might shrink a tumor, but what really the main thing I would like to get across is that it's going to cause an enrichment of the actual mother cell that's beneath the tumor, which is known as the cancer stem cell. So technically you are shrinking the tumor size, but you're enriching the population of the tumorigenic cells at the very same moment. So again, the idea that some people are resistant to chemo and radiation is really a false concept. Everyone exposed to radiation and chemo will have secondary adverse effects, some of which are worse than the original condition they're being treated for.
So when you say, doctor, that there's no money in curing disease, pharmacies, pharmaceuticals, do they perpetuate disease then, in your opinion?
In everything I've seen, in all the autopsies I've done, and I've done several, like more than I can count, of cancer patients, not one of them died of cancer. Quote, cancer. They died of liver failure. They died of cardiac failure, renal failure, all due to chemotherapy. I remember I had an internist and a hospitalist as one of my students, and she studied with me for about 7 months, 8 months. And we got a patient that had been through chemo and radiation, and they had cooked her liver and cooked her kidneys. Her father had been a surgeon that had switched to psychiatry, and he called me up and he said, "Is there anything he can do for my daughter?" And we looked at the blood work and realized she had no organ function to speak of left. And I said, "We can make her more comfortable, but the radiation treatment that they used on her has actually destroyed her organs." And so we did what we could. She'd been given 3 weeks. We gave her 6 months. And she got time to say goodbye to her family. But I remember walking into the office the morning after she passed, and this internist was sitting on the waiting room couch. We hadn't opened yet. And I said, "What's the problem?" And she looked at me and she said, "I'm doing the death certificate, and I don't know what to write for cause of death." I said, "You might try writing the truth for a change." And she looked at me and she said, "You know how much trouble I can get in by doing that?" I said, "If you're going to study with me, you're going to write the truth. If not, go on home." And she wrote radiation poisoning, cause of death. She's the only doctor I've ever seen do that. She actually had the courage to tell the truth. God forbid that you should ever change a cause of death at a university hospital when you're doing autopsies. That will get you out of pathology faster than you can blink.